Good day, everyone. Welcome to our rationalization for our semifinal exam. And we are talking about the nursing practice 5 care of clients with physiologic and psychosocial alterations, part C. And I'm actually in charge of care of adult clients with mood disorders and suicide. Let's begin with question number one. The client diagnosed with bipolar disorder manic episode is being admitted to the psychiatric unit. Which signs, symptoms would the nurse expect the client to exhibit? A. Flight of ideas, extreme hyperactivity and sleep disturbances. B. Feeling of well-being, feeling on a high and talkativeness. Letter C. Aggressive acting out without remorse and callous behavior. Letter D. Overly dependent on others, makes suicidal gestures and argumentative. Of course, we know that uh, letter D is actually a manifestation of a client having borderline personality because of that suicide gestures. And then choice letter C is actually for antisocial personality disorder. And then, of course, we know that choice letter B is manifesting mild mania with symptoms, but that is not requiring a psychiatric admission. The best answer for number one is letter A, which is flight of ideas, extreme hyperactivity, and sleep disturbances. So this patient is required to be admitted to the psychiatric unit because the signs and symptoms are actually considered to be severe, and that is including extreme hyperactivity. Number one, the best answer is letter A. Number two, which statement indicates a client diagnosed with bipolar disorder and prescribed lithium or iscalith, an anti-mania medication, needs more medication teaching? A. My doctor will monitor my lithium level frequently. Letter B. I need to drink at least 2,000 ml of water a day. Letter C. I will have episodes of diarrhea while taking this drug or this medication. Or letter D. I should take my anti-manic medication with food. Of course, we know that there is a need for the patient to have monitoring of the lithium level, such as zero point 0.6 to 1.2 as uh, our normal serum level. And of course, that is actually one thing that we need to do. And at the same time, the patient should need to have diet modification, such as increase in sodium, and at the same time, increase in your fluid intake. Because, of course, we know that dehydration can possibly lead to lithium toxicity. At the same time, the patient should actually take this medication with food because, of course, it is required for the patient's absorption. The best answer for number two is letter C, because if there is presence of diarrhea, that could already be a sign that there is lithium toxicity. And of course, the client should notify the healthcare provider so that lithium or the serum lithium level can actually be evaluated by the attending physician. Number two is letter C. Three, the psychiatric nurse is caring for the client diagnosed with bipolar disorder who's experiencing an acute manic episode attack. Which priority intervention should the nurse implement? A. Decrease the client's environmental stimuli. Letter B. Provide finger foods that can be carried. Letter C. Use a consistent approach with caring for the client. And letter C. Set limits for the client's intrusive behavior. Of course, we have to remember that in prioritizing this answer, we need to follow Maslow's hierarchy of need, which is focused on physiologic before others. So, letter A, decrease the client's environmental stimuli, that is focused on safety and security. Letter B, that is focused on physiologic. Letter C, used a consistent approach with caring for the client, that is actually on safety and security. And then letter D, set limits for the client's intrusive behavior. That's also talking about safety and security. Therefore, the best answer for number three is letter B, because meeting the client's physiological need is considered to be very important, and that is actually being met with, of course, the need for the patient to have the nutritional intake. Number three, the answer is B. 4. The nurse is preparing to administer lithium escalate, an anti-mania medication, to a client diagnosed with bipolar disorder. The lithium level is zero point 0.9 milliequivalent per liter, which action should the nurse implement? A. Administer the medication. B. Hold the medication. C. Notify the healthcare provider. D. Verify the lithium level. Of course, we know that the normal lithium level is zero point 0.6 to 1.2. So zero point 0.9 belongs to the normal level. The best answer for number 4 is letter A. The nurse should administer the medication. Do not hold because it's not beyond the therapeutic level or the therapeutic serum level, and there's no need to notify because that's the result of the diagnostic test. Number 4, alpha. 5. The psychiatric nurse is caring for a client diagnosed with bipolar disorder who is a manic state. The client is wearing bizarre clothes, swearing at other clients, and running around the day room. Which intervention should the nurse implement? Avoiding giving attention to the client's behavior and clothing. Instruct the clients in the day room to go to their bedrooms. Letter C, administer an oral PR and anti-mania medication to the client. Or letter D, provide a safe environment for the client away from the day room. Of course, we know that if the patient here is already swearing, it is already causing possible danger to the self and also to others. So in that case, there's a need for us to make sure that the safety is always a priority. Removing the client and providing a safe environment is an appropriate intervention. So the best answer for number 5 is letter D. Avoiding removing other clients, and of course and giving of an oral medication will not immediately help the client, but it requires ample time. So avoiding that's not actually going to help the patient. Then instruct the clients in the day room to go to their bedroom is actually not appropriate, but our priority is to make sure that our other patients are actually safe. Number 5, the best answer is letter D. 6. The client with bipolar disorder is taking lithium. An anti-mania medication has a lithium level of 3.1, which the treatment should the nurse expect the healthcare provider to prescribe. A. Keep the client nothing by mouth and obtain arterial blood gases. B. Initiate intravenous therapy with gauge 20 catheter. Letter C. Prepare the client for a subclavian line insertion. Or now letter D. Administer the antidote for lithium toxicity. Of course, we know that there is no known antidote for lithium toxicity, therefore, letter D is eliminated. And then, letter A, uh, of course, we know that ABGs are not affected by lithium. And of course, there is a need for us to have the patient uh, on an IV, but it is not our priority. Our priority here is to make sure that the patient will have a subclavian line insertion because the 3.1 milliequivalent per liter of lithium level is totally toxic. It is extremely high toxic levels of the lithium. So therefore, that will actually require the patient to have hemodialysis. That's why there is a need for us to have this patient on a subclavian line insertion, but not an intravenous line. Therefore, the best answer for number 6 is letter C. 7. The client diagnosed with bipolar disorder with acute mania is being admitted to the psychiatric unit. Which room should the charge nurse assign to the client? A. Semi-private room with a client who is depressed. Letter B. The private room that is near the unit's day room. Letter C. The private room, semi-private room with a client who is hallucinating. And letter D. The private room that is away from the nurse's station. Of course, the patient here is actually on manic period. So you cannot actually mix this patient with the patient who is depressed and at the same time the patient who is actually hallucinating because that will probably cause this patient to have safety issues. And it should be that the patient should be on a private room. And since the patient here is actually in acute mania, there has to be less stimulation that you need to do. Therefore, you have to place this patient not near the uh, day room because that will probably stimulate the patient. But it should be away from the nurse's station. Number 7, the best answer is Delta because that's actually quite part of the psychiatric unit, which is away from the nurse's station. So there has to be no roommate for this patient. Seven is letter D. Eight, the client with bipolar disorder is prescribed with carbamazepine or tegretol, an anticonvulsant, which data indicate the medication is effective. A, the client is able to work uh, daily and meet family responsibilities. Letter B, the client takes the medication daily and has tegretol level of 10 grams per deciliter. Letter C, the client reports as 1 on a depression scale of 1 to 10, 10 being severely depressed, or the client denies hearing voices and has no hallucinal thoughts. Of course, we know that this medication is having an anticonvulsant property. So therefore, tegretol does not have any antidepressant property. So therefore, letter C is eliminated. And of course, this is not an antipsychotic drug. Therefore, it will not actually answer the delusions and hallucinations of the patient. And we know that the therapeutic level of tegretol is 8 to 12 milligrams or grams per deciliter. So having 10 grams per deciliter, it does not mean that it is effective, but that is actually the therapeutic level. So the best answer for number 8 is letter A. The client is able to work daily and meet family responsibility. It means that it actually stabilizes the patient's mood, and meeting family and employment responsibilities indicate that the medication has been effective to the patient. Number 8, letter A. 9. The client diagnosed with bipolar disorder is being discharged home. Which intervention should the nurse discuss with the client's significant other? A. Ensure the client takes the prescribed medication daily. B. Explain the need to protect access to credit cards by the client. Letter C. Encourage the client's significant other to take the client to a support group. Or letter D. Tell family members to act normally when around the client. Of course, in this case, uh, the patient is having bipolar and it is to be discharged, no? So the nurse should discuss this to significant others. So the best answer for number 9 is letter B, that explain the need to protect access to credit cards by the client, because of course if the client takes money, probably runs up credit card bills or sells community property during the manic state, the significant other would be responsible but not the patient. So the client should be responsible for taking medication and attending support groups, and family members should act normally when around the client but not tell them to work to uh, behave in a different way. So number 9, the best answer is letter B. Then the male client is running and pacing in the day room, is agitated with explosive behavior and has not slept for 2 days. Which intervention should the nurse implement? Take the client to the seclusion room, have the client throw balls in a hoop, or talk therapeutically to the client, or encourage the client to lie down. Of course, number 10, the best answer is letter B. So the client should actually be engaged on a very non-competitive physical activities that will help that will help tire the client. So that will actually going to make this client feel tired and will then become sleepy. You're not supposed to seclude the patient, because secluding the patient will further agitate the client. And of course, uh, the client will not be able to talk rationally at this time. Therefore, the patient is not expected to be therapeutically talked, and you cannot expect this patient to lie down because of the explosive behavior. Number 10, the answer here is letter B. 11, the client says to the nurse, "Pray for me," and entrusts her wedding ring to the nurse. The nurse knows that this may signal which of the following: anxiety, suicidal ideation, major depression, or helplessness. Of course, if that is giving a prized possession, the best answer is letter B, suicidal ideation. That is a cue of suicidal ideation but not anxiety. So it's actually common for patients having depression, but this only occur when their depression starts to lift. And then hopelessness indicates that there's no alternative available and may lead to suicide. And the statement and nonverbal cue of the client indicate suicide. 11. Answer bravo. 12. Which of the following interventions should be prioritized in the care of the suicidal client? Remove all potentially harmful items from the client's room, allow the client to express feelings of hopelessness, note the client's capabilities to increase self esteem, or set a no suicide contract with the client. Of course, it is very important that we are going to increase the self esteem of the client. And increasing self esteem is an intervention for depressed patient, but not specifically for suicide. And then allowing the client to express feelings and setting a no suicide contract are specific interventions for patients who have suicidal thought, but blocking the means of suicide is part of the priority, and that is letter A. 12. The best answer is letter A. So that is going to decrease then the lethality of the possible thinking of the patient regarding committing suicide. 12 alpha. Next, we talk about care of cuddle clients with personality disorder. Number 13, the male client, the male client mistrusts others, is suspicious, and blames others for his problem. Which type of personality disorder is the client exhibiting? A, antisocial, B, paranoid, C, dependent, or D, narcissistic. Of course, we know that if that is actually mistrusting, it means that there is a problem of trust. So that is all about letter B, paranoid personality, because that could possibly be characterized by pervasive, long-standing suspiciousness and being mistrustful of others. And also there's fearfulness. Antisocial, there's failure of remorse. Dependent, cannot make decision. Narcissistic, there is self-recognition. 13, answer bravo. 14. The client diagnosed with avoidant personality disorder is socially inhibited, feels inadequate, and is hypersensitive to negative criticism. Which priority intervention should the clinic psychiatric nurse implement when caring for this client? A. Encourage the client to attend a weekly support group. B. Tell the client to socialize with others for 15 minutes a day. Letter C. Talk to the client honestly and in a straightforward manner to establish trust. Or letter D, identify the client's strengths and accomplishments. Of course, the best answer for this one is letter C, that establishing, talk to the client honestly and in a straightforward manner. So that is one way of establishing trust with the client, which is considered to be a priority nursing intervention, because without presence of trust, the client will not be able to talk and not be able to work with the nurse. So if we focus on encouraging weekly support groups, including socialization, and at the same time identifying the client's strengths, are considered to be appropriate interventions but not a priority over establishing trust with this patient. Answer for number 14 is letter C. 15. Which individual would a nurse suspect has a borderline personality? Is it the male college student who blames his parents because he does not have enough money to live on? There will be the homeless woman who wears layers of clothing, two or three knit hats, and unmatched shoes and socks. Letter C, the high school student who suspects everyone in the big class is cheating because everyone makes a better grade on a test. Or letter D, the woman who threatens himself, killing himself, where her husband leaves but is out dating within the month. So, letter A is an example of a dependent personality. Letter B is schizotypal. And letter C is actually paranoid. The answer for number 15 is letter D. That is a personality, borderline personality, which has an impulsive behavior and makes suicidal gestures. 16. The female client, diagnosed with antisocial personality disorder, has an appointment in 30 minutes. She is loud and obnoxious, will not sit down, and demands to be seen immediately. Which intervention should the clinic nurse implement when caring for this client? A. Tell the client to sit down or she will not be seen at her appointment time. Escort the client back to the psychiatrist's office so that he can be seen next, or ask the client to leave the waiting room and cancel the appointment, or letter D, request one of the staff to sit with the client in the waiting room. So the best answer here is letter A. The client, tell the client to sit down or he will not be seen at the appointment time. That is actually part of limit setting. And at the same time, uh, cannot allow the client to manipulate the staff to be seen earlier. That is also setting, maintaining limits, and it's important intervention for the nurse. So if you're going to allow the client to see the healthcare provider, that is going to allow the client to win. And asking the client to live and sitting with the client are not appropriate intervention this time because the patient here is very manipulative. 16, the best answer, alpha. 17, the wife of diagnosed the wife of a client diagnosed with narcissistic personality says to the clinic psychiatric nurse, I just can't live with my husband anymore. Can anything be done for to help him? Which statement is the nurse's best response? If he would take his medication daily, this would control his behavior. You don't think you can live with your husband anymore? Individual and weekly group therapy may help your husband. There's no definitive treatment to help a client with personality disorder. Of course, letter B is eliminated because that is actually answerable by a yes or no. And then letter A is opposing with letter B. And we know that when you talk about your personality disorders, there is no specific treatment for that to help control the symptoms for the client. So the best answer for number 17 is letter D. 18. Female client has a low self-esteem, is unable to make decisions, and sees herself as stupid. Which type of personality disorder would a nurse suspect the client as having? Dependent, histrionic, schizoid, or obsessive compulsive? Of course, we know that this client has been manifesting uh, dependence. So the best answer for number 18 is letter A, dependent. Histrionic, that is the core of the team. And schizoid, there's a problem of trust, and obsessive compulsive, there is actually ritualistic behavior. So number 18 is letter A. 19. The client who is 3 days postoperative total knee replacement is diagnosed with borderline personality. The client is demanding healing for the nurses and argumentative with the staff. The nursing staff does not want to be assigned the client. Which intervention should the charge nurse implement? Request the client be transferred to the psychiatric unit, rescheduling a meeting to discuss the client's behavior, tell the staff members they have to take care of the client, or explain to the client to stop this behavior immediately. So in this case, the staff needs to be consistent with the client and plans interventions to address the manipulative behavior. So the best answer here is letter B. So the client cannot be transferred to the psychiatric unit, and the client cannot help this behavior. Helping the client staff deal with the client's behavior will help the staff care for the client. So number 19, bravo. 20. The husband of the client asked the nurse, someone told me my wife has a histrionic personality disorder. What does that mean? Your statement is the nurse's best response. A, the person is flamboyant and always needs to be the center of attention. Letter B, histrionic personality means the person is very orderly and very rigid. Letter C, does your wife keep isolated to herself and have no close friends? Or letter D, this type of person is unable to conform to social norms. Of course, for letter D, that is for antisocial because there's a problem with social norms. Letter C is schizoid personality. Letter B, that is specific for obsessive compulsive. Number 20, the best answer is letter A. 21. A public health nurse visits a client's home and discovers a multitude of cluttered possessions taking up to 75% of the living space, obscuring entrance into the home and access to all rooms except the bathroom. The chairs and tables are covered with various objects. The nurse interprets the client's behavior as in a, inability to focus related to passive aggressive personality behavior, inattentiveness surroundings related to borderline personality disorder, and attention seeking behavior related to histrionic personality disorder, or hoarding related to an obsessive compulsive histrionic or obsessive compulsive personality disorder. Of course, the best answer for number 21, there is hoarding, and hoarding behavior is an associated behavior for obsessive compulsive disorder. So therefore, the answer here is letter D. That is letter D. Holding on or hoarding is a compulsive behavior done to excess, and this should lead to associate with obsessive compulsive disorder. 22. A nurse should anticipate that a client diagnosed with antisocial personality disorder may use the primary ego defense mechanism of A. Compensation, B. Projection, C. Sublimation, or D. Rationalization. Of course, we know that compensation is considered to be a process of counterbalancing weakness with strength. This is more mature defense mechanism, and we know that sublimation is a channeling of unacceptable impulses to thoughts and emotions into acceptable ones. And we know that rationalization is also putting things into different acceptable perspective. The best answer here is projection because uh, usually projection is to attribute a person's thoughts, feelings, or impulses and to another person who does not have these thoughts, feelings, or impulses, and usually coercion and personal profit motivate these individuals and they attribute these feelings to others. 22, the answer is projection, B. 23, when working with a client diagnosed with paranoid personality disorder, a nurse understands that the client most likely receive a little affection or approval in childhood, experience lack of empathy and lack of nurturing during upbringing. Letter C, experience an early upbringing characterized by indifference leading to a pattern of discomfort with affection. Or letter D, receive recognition for accomplishments in early childhood but not during adolescence. Answer for number 23 is letter A. Individuals with paranoid personality disorder may have been subjected to parental antagonism and harassment. They served as scapegoats for displaced parental aggression, and eventually gave up all hope of affection and approval. If there is lack of empathy, and at the same time that is specific for schizoid, and an early upbringing characterized by indifference is specific for schizotypal, and of course a client likely received no recognition for accomplishment. That's 23. The best answer is alpha. 24. 45-year-old male, client with no psychiatric history, is admitted to an emergency department after a psychiatrist physically assaulting his wife. The client is frightened by his loss of control. The client has a nurse. He is self-employed, recently expanded his company nationally, and he has many well-known friends. The client's wife angrily states that's what it's important to you. uh, who knows and how it looks despite the business recent financial loss. The client continues his lavish lifestyle. The nurse determines that the client's behavior is a typical of, is it borderline, schizoid, narcissistic, or dependent? Of course, the best answer here is letter C, narcissistic. Not borderline because there's no suicidal thoughts, and it's also not schizoid because there's no uh, social detachment, and it's also not dependent because self-esteem is not mentioned. Answer C, narcissistic personality. Which should a nurse include as a primary outcome for an individual with schizopersonality disorder? Validates ideas we are taking, able to function independently, cope and controls emotions, or recognize limits. Answer here is able to function independently in the community because this focuses on improving functioning with in a community, and it validates ideas before acting. So you have to use the nursing process, especially in your knowledge about schizopersonality disorders, to eliminate outcomes that pertains to paranoid, borderline, and antisocial personality disorder. So 25, the answer here is bravo. So that is it. Thank you so much for your time, everybody.